Thank you all very much. I've been sitting here all day thinking, Jesus, this is like a conference in the 1970s. You're all still using pencil and paper and moaning about junior doctors. Anyway, we still train people in silos. We still train people to do the same kind of stuff that they were doing in 1948. Okay, we train them better and they do a better job and all the rest of it, but fundamentally the workforce hasn't changed since 1948. And it just seems to me, if we want to change the NHS, and everybody's saying, oh, we've got to change the NHS, modernise it, and innovate, and all the rest of it. If we're going to change the NHS, then we have to change the workforce. You can't change work unless you change the workforce. And I thought that was really interesting, because I've been sitting at the back there listening to your conference, and it seems to me that we've been coding. You know, somebody's been dumping on your desks piles of illegible paper. And every 13 minutes, because I worked it out sitting at the back there, every 13 minutes you're supposed to provide a finished piece of coding. It's Neanderthal. You've got to stop. We can't carry on like this. What are you doing? Where's the leadership in this sector? I read on the report last night, CHKS report, error rates between 1% and 43%. Oh, really? And the average rate is 7. I think 7%. I think it's a miracle that you get it down to 7%. If somebody said to me the error rate was 20%, I'd say it was heroic, the way that you have to do it. You're relying on junior doctors who don't give a toss about doing it. Consultants who are too important to do it. I don't know how you do any of it. How the hell do you do it? And if I was running a hospital, the thing I want to know most is who gets sick, did we fix them up, what did it cost, and do we want to do it again? We can't answer any of those questions without you sitting there unfathoming a whole fandango of bits of paper every 13 minutes. You should work for McLaren. In 13 minutes you could do 4 tyres and a tank of petrol. I mean, it's just balmy. We have got to find a way of helping you do what you do. Where is the technology in this business? What happened to SnowMed? Oh, don't talk to me about SnowMed. We don't want bloody SnowMed. I hope SnowMed's taking a bloody hike. We can't carry on like this, can we? We haven't got enough coders. We haven't got enough people that want to do it. It's no good doing what you're doing and hoping things will change, hoping for the best, crossing your fingers, lucky rabbit's foot. Got to think differently about how we provide the services. Are you going to get more people with the money that you've got? No. Are you going to be able to code more in 13 minutes than you are now? Well, bust your ass, bring it down to 10 minutes. No. Is this going to work? No. Can you work any harder? No. Have we got to change the way we do what we do? Because otherwise we'll always get what we've got. You see, simple questions. Why are people sick? What fixes them up? Did it work? Do we want to do it again? How much did it cost? 5 simple questions that you have the answers to. 5 simple questions that if we analyse what you do in 13 minutes, we can answer all those questions, but we don't do it. We have the finest data set in the world. We've been collecting data on people's healthcare since 1946, and we don't use it. You can unlock all that. What you do is so much more important than $3,000 for a hip. Or is there a, what did you call it, a patella? Who the hell would want that? No, I've got to say, no. Don't start me with colorectal, Jesus Christ, poking about the Kazi in a spoon to see if you've got, oh, it's horrible. No. You can do all that. I don't think you realise how important you are to the future of the health service. It's not just adding up what's happened. It's not just having a row with a junior doctor who's got bloody awful handwriting or can't spell or can't use a computer. What you are doing is at the very heart of any business. If this was a business, you'd be on the board of directors, not working in the bloody porter cabin. How did you get into this mess? as a profession, you have the key to the future in your hands. It's not about 13 minutes. It's about the rest of our lives. So I'm really pleased I came today. And I'm pleased I came early, because the shepherd's pie was terrific. And they've closed my day centre and there's no bingo. But I'm pleased I came, and I'm pleased I met you, and I'm pleased I've seen what you've done, and I'm pleased I've seen the problems that you've got. And I'm pleased to be able to say to you, this can't carry on. You're much too important. We can't have another 10 years of you sitting in a porter cabin doing something every 13 minutes that is based on probably inaccurate data provided by an exhausted junior doctor. We have to bring technology into this. There must be a way of doing it. You have to be the data masters, the change masters of the new NHS. Because if I was running a trust still, I would want to know what happened this morning in my hospital to spend money, to employ people, and to make my customers happy. I would want to know why they weren't happy. Most of all, I would want to know why they were complaining. I would want to know who did what and when and how and did it work. And you have the answers to all those questions. So really, I just want to say thank you. I want to say thank you for the job that you do. I want you to take the job by the scruff of the neck and put it front and centre. Because I don't believe there is a chief executive in the country that's seen what I've seen today in this place, sitting at that table, who wouldn't say the same thing. Jesus, these people are important. So, I want you to do something for me. Will you stand up, please? Stand up. Will you face that way? That way? And would you give the person in front of you a pat on the back and say, bloody well done?